All right. Hi, Ms. Dural. Thank you for coming to our clinic. I know it's your first visit here, and so thank you for filling out your medical and dental history forms. Before we start any procedures, I just wanted to follow up on some of the information you provided us, just to make sure that we have as much information as we need to make sure everything goes as smoothly as possible. Are you okay with that?
No problem.
Okay. So I see here that you listed that you are pregnant, and would you could you restate which trimester you're in?
I'm currently in my second trimester.
Okay, second trimester. Okay, yes, I see here. And oh, I see that you've been dealing with gestational diabetes and RH, it's an RH negative pregnancy. Is that correct?
Correct.
Okay. Are you taking any medications for that?
Um, just insulin as needed. Um, and I take my prenatals, of course, daily.
Okay.
But outside of that, not too much extra.
Okay. That's good. That's good. Um, are you taking any hormones, hormone replacement, anything
No,
like that? And are you taking any vitamins, mineral, herbal supplements?
just the prenatal vitamins. I do take iron supplements daily and then folic acid.
Okay. Okay. All right, thank you very much. One second, just looking over here. Okay, no allergies, correct?
No.
Okay, and diabetes. Okay. Okay. And just to go over your dental history, when was your last dental visit?
It was back in April of
Okay.
this year.
Okay, and you're not feeling like anxious to be in a clinic setting,
No,
anything like
I
that?
don't usually mind.
Okay, okay, that's great. I see here that you have checked off that you've been having a bit of bleeding gums in the past 2 years. Does that happen like while you're brushing or flossing, or when does that?
Yeah, it mainly started during the pregnancy. So it's usually when I'm brushing, and then actually, it's only sometimes when I'm brushing, but it's mainly when I floss.
Okay. And what kind of toothbrush are you using?
It's a medium, like bristle toothbrush.
Okay. Yeah, well, in general, it's pretty good to use soft toothbrushes because the medium, even though they're not necessarily very hard, they're still pretty rough on your teeth and your gums. So that could be something that's contributing to the bleeding gums themselves.
Okay.
So after this visit, I would definitely recommend looking into some of the softer toothbrushes.
Okay.
Um, and for flossing, are you just using regular string floss, or do you have any other devices that you use?
I use like floss picks. I prefer the floss picks.
Okay. And that's mostly what you use. Do you not use string floss?
Not really. I prefer not to. It's a little, my teeth are a little tight, so it's kind of hard to wedge in there, and I feel like it makes them bleed more.
Okay.
So I prefer
No.
the floss picks.
Okay, that's fair. Okay. And how often do you brush and floss? Is my main.
I brush twice daily, flossing about like 3 times a week or so.
Okay, perfect. So difficulty cleaning teeth. You did describe a little bit of the tight interproximal area there between your teeth, and so you like those toothpicks, not toothpicks, floss picks. Apologies. Um, okay, well, I see here that it seems like you filled everything else out very well. Okay, and so for your medication, just to go over that, you said you were taking insulin and
Yeah,
you're only taking that as needed based on,
my glucose readings.
okay. And did you say you're taking acetaminophen too?
Yes, my doctor recommended it just as needed for any discomfort that I feel throughout the pregnancy.
Okay. And just to go over one more form with you, for radiography, are you employed in an occupation which exposes you to X-rays or other forms of ionizing radiation?
No,
Have you ever had radiation therapy in the head and or neck area?
no,
Have you? been exposed to extensive medical radiographs within the past 5 years?
No.
Have you been exposed to full mouth series within the past 3 to 5 years?
Yeah, I believe around April of 2023-ish.
Okay. Put down. Have you been exposed to a panoramic film within the past 3 years?
No,
And have you been exposed to any bite wings within the past year?
no.
Okay. Okay, so I think based on all the information you've given me, I should be able to make sure that we have an accurate assessment of what would be a good dental care plan for you going forward. Um, if I have any questions, follow-up questions, I will reach back out to you. But if you don't mind, I'm going to step out for a little bit and start talking with the dentist to see like what would be the best plan to go forward with you.
Okay,
Okay, thank you very much.
thank you.